Hey guys, so you need to have your labor induced or you want to go into labor ASAP. We are going to show you the exercises that you can do now during your pregnancy to help your induction go easier, and spoiler alert, you're going to have a better pregnancy when you do it.
You're like a circle that floats around me, keeping me safe and sound. And when I fall...
Hey guys, welcome back to my channel. My name is Mandy Irby. I'm the birth nurse, and here I believe that our bodies are powerful, and with the right support, we are unstoppable. I have a special guest, and we are doing 3 videos for you, and I am so excited. I am so lucky to be here with Laura Wurst. So if you agree that your body is powerful, or you just want to see what the heck we are going to do on some balls, and if you cannot get into the Roanoke Spitting Babies parent class, which I'm teaching regularly, or with Laura because she's always booked, then we are going to give you some tips and some tricks and some hacks to be able to do some of this stuff on your own. So stay tuned and subscribe if you haven't. Click the bell for our next videos so you get notified. Okay, so I am with Laura Wurst. Tell me your site again.
PowerfulHealingArts.com.
She is an educator, perinatal massage therapist, doula, trauma-informed care provider, trauma-informed doula, trauma-informed everything. Yeah. She is in Alexandria, Virginia. I am at her office right now. Why are you sitting on a birth ball?
I'm sitting on a birth ball because, yes, your body is powerful and it can do amazing things, but we also need to keep it balanced. We need to keep it happy. We need to keep your hips open so that they can help you deliver that baby if that's your goal. And sitting on the ball, if you sit on your sits bones, which we can help you find,
Yes.
You're going to want to take your 2 fingers, you're going to want to put them under your butt where you feel your two bony points, and that is how you're going to want to sit. And if you don't feel them on your fingers and you're sitting too far forward or too far back, that's not really great sitting. It's not going to help keep you balanced. So we want to sit on our sits bones for a reason. So I am sitting just like that on this birth ball. It's super comfortable. And when you're sitting this way and you're pregnant, it allows you to have a lot of good release in your back. It allows you to do some hip circles if you want to keep everything open and happy. And I'm sitting on this ball so that we can show you some of these exercises very shortly.
Okay, so we're going to do mind, body, baby in these videos because that is Laura's specialty, and you all know that is what I love too. So mind, body connection, you're already going there because you're already like moving in a kind of like loose way. But to be intentional about these exercises on the ball, it's more than just sitting and watching TV.
Yeah.
So you're sitting forward on your sits bones. What about like a pelvic tilt? So on the ball, one benefit is that you can move in a way that you can't with a chair.
Right.
You already said it's probably more comfortable because like being in a chair doesn't help you to sit on your sits bones. So that's our norm, but it's not balanced. It helps your back stretch a little bit, which already feels good. But what does a tuck do?
So if you're sitting back and you're just in a chair, you're on the couch, you're gonna want to do this. It's comfortable because your back hurts, right? There's a baby, there's a lot of things happening in your body. But that also allows baby to fall back and away from the pelvis and won't engage with your pelvis when you're trying to give birth. So we don't want to sit like this all the time. We want to be a little more forward, or we want to be balanced so that baby can go forward in the body and engage to come out of the pelvis, which we can talk about in a little bit. So if your pelvis is possibly tilted or you're sitting this way all the time, you're not engaging anything and you're keeping a lot of those muscles that are tight, you're keeping them tight. So if you're tucking your pelvis and you're moving your pelvis, you're strengthening the muscles that need to be strengthened, you're loosening the muscles that need to be loosened, so it's creating a balance for you so that when your pelvis needs to move, it can open to help you deliver your baby.
I love how you said that. That makes total sense. Like you're balancing your pelvis to improve range of motion and flexibility, where we don't need to be that flexible in our pelvis when we just go to work. But when a person comes through is when we want our pelvis to be really flexible to do its job really, really well.
Yeah, we really want it moving. I mean, I want your pelvis moving all the time because a lot of people are sitting at desks and things like that. But if you're just sitting in one position, you're not going to be able to engage your pelvis the way it needs to, and baby's not going to engage and do its job because your baby has work to do too. So this is your work to help your baby work.
Okay, so who has a ball at home and who is getting their ball this week? Let us know in the comments. What size are you? Laura is 75 centimeters on this ball. This is a 75 centimeter ball.
Yeah, this is a great ball. This is really comfortable. I recommend 65 to 68 minimum just to sit on and feel comfortable, really good range of motion on it. But this 75 ball will give you a lot of extra room, especially if you're a little bit like me with a little bit more mass on your body, which is totally fine.
Yeah.
This ball is really going to support you and you want to feel supported in your pregnancy.
Squats. So another exercise is, this is for pelvic floor range of motion, and also I really love what you said a minute ago about understanding what your body does with your mind. So being
Intentional.
Intentional, yeah. Okay, so being intentional with a squat. So I'm gonna just...
what I'm gonna do is I'm gonna rock back on the ball and forward on the ball and back on the ball and forward on the ball, and that's gonna be what you're gonna want to do to engage your pelvis a little more, and that's what we call the tuck. So we're not just sitting like this and sitting back, or we're not just completely sitting forward all the time. You want to do both while Mandy gets everything ready to do this squat. And how this feels is my lower back is engaging, my hips are opening a little more, I'm feeling it on the sides a little bit, so that when my pelvis, if I were giving birth, needed to open a little more, it would have that range of motion. It wouldn't just be stuck from sitting in a position all the time. Let's do a squat. So I like to have something sturdy to hold on to, especially if your center of gravity is off because you are carrying a baby, you're pregnant. So a door that's attached, and make sure everything is firmly connected. You're just gonna kind of want to hold on to this. You're gonna want to spread your feet so that they're under your shoulders. Make sure you're aligned. Get your feet and your hips and your shoulders all aligned so that you're sturdy. And what you want to consider in this mind-body-baby connection is that your pelvis and your perineum, also known as the taint, some people call it that, perineum, you want to consider that when you're squatting, that's moving toward the floor and you're opening your pelvis. Like, you want that connection. You want your perineum and you want your pelvic floor to open so that it's relaxing, it's stretching, and you're making room for baby. So that's the intention you want to set when you're doing this. And you want to just breathe into it. And it's not anything, we're not doing any cardio or anything like that, but you just want to mindfully just like take the time and breathe and open up. Okay, so just kind of hold on to the door and make sure that you're aligned, and then you're just gonna kind of squat into it like this. Imagine there's a chair here that you can sit in, and you want to put your butt out, and you want to bring your pelvis and your pelvic floor toward the ground so that it can open. And just take a breath and just dip into it and then come back up. And you're gonna just dip in and come back up. And what I'm feeling in my pelvis is like my pelvic floor feels like it is opening and spreading, and that it's kind of making that connection through my root chakra to the floor. Make sure you're aligned really well, and you're gonna wanna put your butt out a little bit and breathe into it. Yeah.
And I'm really holding onto the door.
Mm-hmm.
Like I'm swinging back. Okay. Ugh. My back is tight.
That is great. I think because we need to do it more.
I'm sticking my butt out and I don't often do that.
Right. This is also something that people don't always do unless you have a pelvic tilt naturally, in which case when you do this, you're gonna wanna tilt your pelvis forward.
Oh.
And then squat that way.
How do people know if they have a pelvic tilt naturally? Like, would you, as my massage therapist, be able to talk to me about that?
Yes.
Okay.
So I also have a little bit of an anterior pelvic tilt where my butt tends to go out a little bit.
Okay.
So your low back kind of makes a little bit of a curve outward, and your butt tends to be a little bit more outward. So what we have to do is we have to try to strengthen the front and bring it forward instead of being out. So we want it forward, which is also going to be different because you have a baby here now. So it might be a lot of work and you don't want to strain anything, but when you're trying to do this lift and tuck motion on the ball, it's the same thing with if you're standing. So you can stand, and if your butt is out, you want to pull it up. You want to like lift and tuck it in, and then you can squat that way. So that you take the pressure off of your back. And when you're squatting, if you already have a pelvic tilt, you don't have to put your butt out any further, it's already there. The goal is to balance the front of your body to keep the round ligaments in the back happy. And we're doing this squat so that the round ligaments in our back can open up so that you don't have that back pain up here, and so that you can open up your pelvic floor.
So I'm already thinking that I wish I had a massage therapist like Laura who knows all the things. During my pregnancies, I had an amazing chiropractor. But can you tell why, like we can teach you a little bit, but your individual story is going to affect what you need and how you do things. So these are just tidbits because we love you, but going to an individual is really going to make a big difference. So Laura is now going to do a sideline release on me, which we learned from Spinning Babies. And that led me to become a Spinning Babies parent educator in Roanoke, Virginia. So if you're in Roanoke, I can teach you how to do this. So we learned from Spinning Babies, and this is a sideline release to stretch the pelvic floor, which you can do at home. Oh, you talked about doing this before you do massage?
Yeah. So before I do massage, I like to incorporate this move and educate my people so that they can go home and do this move without me, because I'm not always going to be there. I'm sorry, I'm not, but I'm not. And I want you to feel empowered that your body can do anything, and that you can own your birth, and you can own the birth that you want, and that there's things that you can do to try to be successful. So I teach this move on the sideline release, and I teach some moves where you lie on your back and we release a little bit of the psoas just by moving your leg, nothing else. And I also teach some rebozo and things like that, which we're going to get into.
Yeah, you'll see.
Spoiler alert there too.
Yeah, spoiler alert. You have to keep watching.
So before we even get into the massage, I'm stretching you and teaching you all of these things, and then you're going to go home and do them as well.
Awesome. So this is work. This is a lot of work.
It's a lot of work, but it's worth it.
It's so worth it. So would you do jiggle or sideline release first?
I would do sideline release so that when we jiggle, the muscles are already a little bit more loose and willing to move.
Okay.
So what I have people do is you're gonna find a bed, a sofa, a counter where your feet will not touch the floor once you move your leg over to the side. Okay. So you're gonna want to acquire a pillow, and you're going to be on this very sturdy surface. You're going to need a partner or person to assist you. I'm right here. So what you do is you lie on your side, and if Mandy were pregnant right now, her belly would be hanging over or close to the edge of the table. The farther along we go in pregnancy, the more it's going to hang over the table, and you're going to be right up against the edge of this table, okay? It's going to feel like you're going to fall off, but don't worry. Your partner is going to catch you. It's going to be all right. They should not be dropping you. So partner, you're going to want to put your knee and like plant your knee firmly and like make sure you're secure to hold on to your partner, okay? So your partner's here with their belly, they're lying on their side. The first thing we're gonna wanna do is make sure that the hips are stacked and that the shoulders are stacked. If they're not stacked, it's not going to work as well and you're not gonna have as much balance as you need. So Mandy, I want you're gonna bring this leg over and you're gonna drop it down. I'm gonna hold you, and then you're gonna bring the other arm up above your head. Excellent. So you have a long torso. I'm holding this hip securely, and my leg is here in case Mandy happens to move forward. My body is planted here to catch her, okay? Because we want safety first. Now with this other leg hanging, you're gonna start to feel in the low back, in the hips, a really good stretch, okay? If your hips were tighter, this leg might be up a little further, maybe like this, maybe just like this. But ideally, we want that leg to eventually drop a lot further down, and that's going to be an indication that things are pretty loose and moving really well. And with the shoulders stacked and with the hips stacked, we can also kind of hold on to the side of the body here and just do gentle pushes upward toward that arm and stretch out this mid body just a little bit. We don't want to use a lot of pressure. How's that feeling?
Nice. I could take a nap.
Excellent. I mean,
And
you
how
can.
long?
We'll wake you up when it's over.
A few minutes.
Just a few minutes. Power nap. And then what we can do is feel free to, if your partner or person is okay with it, feel free to kind of gently push on the glutes a little bit and gently push on in front of the thigh and this quad a little bit, just to help some of these muscles open up because they all attach into the hip anyway. But if you just want to hold the hip bone and make sure that your person is secure, that's fine too. And you're gonna want to do this just for a few minutes. How long do you recommend?
3 to 5 minutes.
Yeah.
Or a few contractions during labor.
Yes. So let's say 3 to 5 minutes has passed. You're gonna wanna bring that leg up, bring that arm down. You're gonna roll to safety in the middle.
Yep.
And then what I would do is I would flip to the other side and repeat that process.
Always do both sides. If you guys don't have rebozos, it's okay. We still like the exercise of jiggling or vibration. And Laura and I talked about that. We use that with our clients all the time. We teach our clients all the time. So we want to show you what that is. And I want to hear a little bit about what does that have to do with the mind body? How is the mind, how are we helping the mind and like our emotions, besides just physically get ready to either be induced or go into labor on our own?
Okay. So when we jiggle and when we move energy throughout our body, sometimes a jiggling motion is a good way to unlock not just a stuck muscle, but it's a good way to unlock some stuck energy. Maybe your hips haven't moved that way in a long time. Maybe those muscles have been sitting at a desk while you've been pregnant for 9 months. That's a lot. So we want to kind of jiggle things loose, shake it up a bit. Not really roughly, but we want to bring some good blood flow, some thoughtful energy to that area, and we want to let your body know like, hey, we're thinking about you and you're powerful. So we're going to shake it up and prepare you for this birth, and we're also going to help loosen the muscles and the fascia and all the stuck old blood that's in there and bring about new everything.
I feel like vulnerable during, is that weird?
No.
When someone does that to me, I feel like I need to be able to trust them for them to do that because it's not at first super awesome.
Right. So commonly what we find is that we say jiggling or shaking. We want to call it also like just vibration. We often in our culture don't want to jiggle and we don't want our bodies to shake, but they do, and it happens and it's awesome. So if you're feeling vulnerable in your body, make sure that this is happening with a trusted individual, someone that you feel comfortable with, that you feel safe with, that you know has your best interests at heart, and have that conversation with them and say, I'm feeling vulnerable right now. Make sure you're doing things to take care of yourself and make sure that they are following protocol for consent. Ask if you can touch someone. May I put hands on you? May I touch you this way? Is that too much pressure? Is that pressure okay? Would you like more pressure? And another thing you can do is how you're shaking someone. Is this speed okay? Use a 1 to 5 scale. 1 is very slow, 5 is very quick. How are you feeling with that? It's really great to check in, and I love consent culture too, so.
Yes.
Let's make sure we're doing those things, even if it is your partner that you're having this baby with.
Yeah.
It's still their body and their space, and we want to make sure that they're safe and feeling comfortable and secure.
So you're just gonna do open palm. That's all it is. Just jiggle, right? As long as you want. So easy.
So what you can do is you can do it while you're lying on the side. You can also do it If you're in cat-cow position, you can shake both hips at the same time, and we can do that if you want.
Whoa. Okay, cat-cow's coming up. We're gonna do cat-cow in the next video, so stick around. Have you guys ever done any sort of jiggling or vibration? And also, tell us about your prenatal massage in the comments, because next I'm gonna ask Laura all about prenatal massage, what to expect, and what the heck does it do for you. So join us in the next one, and we'll see you there.
I love this giant ball. There's so much space on this.